Hello cruel world, my name is Dr. Sohom Das. I'm a consultant forensic psychiatrist. I assess mentally disordered offenders for a living so that you don't have to. So today's video is about Simone Biles. You've probably heard of her. She is a very successful gymnast from the States and she has courted controversy, I think is fair to say, in the last few weeks. So around July 2021 in the Tokyo Olympics, she pulled out of one of the main events, which is the women's gymnast team finals due to mental health issues. Although since then, more recently, in the last couple of days, she competed in the balance beam competition and won bronze. I think it's fair to say she's polarized people, so she's got a lot of support, a lot of criticism. So this video is my 2 cents, firstly about those comments and those criticisms, and my personal opinion. So sit back, relax, and welcome to Time for a Quick Shrink. So one of the reasons that Simone talked about why she pulled out was because she had what she calls, what's in gymnast circles known as the Twisties. So that's kind of feeling disorientated in midair and not being sure about how to land. I think that's very significant and I'll come back to that later. So just to give you a very brief summary of Simone's background, I'll tell you the following. This video is not really about her background, it's more about the reaction of everything, but just very briefly, I think it's fair to say that Simone is extremely successful. She's won every all-round comp since 2013. At the last Olympic Games in Rio in 2016, she won 5 medals, 4 of them gold and 1 of them bronze. Now, I think it's fair to say that the early life of most athletes is quite harsh. It's very strict, there's a lot of training, a lot of pressure. Arguably, it's even worse for the average gymnast because, for example, they have to maintain a certain weight and a certain body size and shape. On top of all that, we know for a fact that Simone Biles was one of the many victims of Larry Nassar, who is this sort of very evil, corrupt, paedophilic doctor who abused lots of American gymnasts and was sentenced in 2018 for his crimes. So what I'm trying to say is I don't doubt for a second that Simone Biles has had a very harsh upbringing and adolescence, and I think it's very valid that she might have mental health problems. So Simone Biles' decision to pull out due to mental health issues polarized people, I think is fair to say. Love that word. She received props from lots of famous people, lots of celebrities, for example, from Justin Bieber, from Michelle Obama. I spoke to both of those people on the phone just before this video. Justin says hi, and Michelle keeps telling me not to call her anymore. Such a kidder, that Michelle. But Simone also received some vitriol. Love that word. For example, Aaron Wright, who is the Deputy Attorney General from the state of Texas, which is where Simone is from, called her a selfish, childish national embarrassment. And he compared her case with that of Kerri Strug, who is another female, famous, successful gymnast from America who 25 years ago had an ankle injury yet continued in the gymnastics event and ended up winning gold. So I'll be honest, my gut reaction was to kind of support Simone. My gut reaction was to advocate for people with mental health issues because I'm a psychiatrist, and to think of her as basically being brave for not crumbling under this pressure. But then I read a bit more about it, and I will tell you my final thoughts, but I think it's not quite as simple as that. And simply because it's a different context from everyday life, it is the Olympics. So you're expected to be one of the best in the world. And I think the boundaries are different from normal day life. And I think an issue that can't be overlooked is the very fact that the Olympics only happen once every 4 years. So it's a huge opportunity, which means that if you miss it, that is a massive shame to everybody involved around you. So it's not, for example, like Premiership footballer, who if they had a mental health issue for a game or even, a week or even a month, they can still return to their career. The Olympics is different because it's so special, it's so rare. And I have to say, when I heard about the story, it kind of reminded me of the situation of Scottie Pippen. So he played for the Chicago Bulls, and in the 1990 Game 7 of the finals, he had this really bad headache, and he did play, but he sat out quite a lot some of the game, and he only scored 2 points, which is not very much, from 1 for 10 shooting, which is abysmal. So for those of you who don't know, Game 7 is literally the last game, so it's the best of 7 games, so it's come down to the final game of the season, and he couldn't perform, which I think is an argument for not pushing people if they're not at their peak, because they're not going to do their best. But the counter argument to that is that that's a team game, so if Scottie Pippen didn't play, then he could have given his spot to another player who could have, kind of worked hard and compensated, whereas obviously something like the Olympics, in an individual spot, what Simone did would have just led led to a gap in the roster. Nobody would have stepped up and replaced her. So I think that there is an argument, I'm not saying I think this, but there's at least an argument that we should consider, which is that the Olympic spot is so important that that's part of your responsibility, is being able to handle the pressures, is being able to overcome mental health difficulties. And also when I thought about this case, I thought about Michael Phelps, who's an Olympic swimmer, as you know. He battled with anxiety and depression, and he was brave, there's no question in my mind, for coming out. But the difference is this, is that he has come out publicly with his mental health issues and has tackled them outside of the Olympic Games. He's kind of done his best to remain professional and remain working in his field outside of that context, which is very different from pulling out at the very last minute. And I do not think it can be kind of overlooked about what it must feel like for the person's place that she took. So imagine that you just didn't make the cut of the American Olympic team. So you're still a gymnast, you still train every day, presumably, or almost every day. You still dedicate your life, you still make your sacrifices. And for whatever reason, maybe you didn't train quite as long or as hard as Simone, maybe you're not quite as talented as Simone, but you just didn't make the cut. Can you imagine how that would feel? That person's probably not thinking about the bravery of coming out with mental health issues. They're probably thinking about missing a spot on a team where somebody has chosen not to compete. So I actually read an article in The Guardian. For my foreign viewers, The Guardian's a very left-wing renowned paper in the UK. And it said, it kind of congratulated Simone, very reasonably, for stepping out and making this decision publicly. But The Guardian article wrote, Simone doesn't owe anybody anything. She doesn't owe her country, and she doesn't owe her sponsors. I'll put a link for that article in case you're interested. I completely disagree with that. Of course she does. That's exactly what the Olympics is about. It's a privilege to be there. And even though she earned it like all Olympic athletes, she is absolutely representing her country. And she does have a deal with a sponsor, so she does owe those people. I guess what I'm trying to say is that her pulling out is not her making that one decision in a bubble which doesn't affect anybody else. Lots of other people would have been affected by that decision, like her coaches, her teammates, her family. So I'm sure her family made sacrifices. Now, I think it's more than likely that her family would trump her mental health over the sacrifices they made. So maybe they're happy that she pulled out if it's for her own well-being. So I'm not saying that they're annoyed or irritated at her decision. All I'm trying to do is point out that her decision affects other people. She's not in this bubble. And the average person, yourself, myself included, might not necessarily have sympathy for multinational global corporations, but it would have affected her sponsorship. I mean, she still would have had a contract with those people. And again, that's not in a bubble. There would have been work behind that. There would have been people that put together that sponsorship deal who potentially have lost money. Her agent, for example, Simone's, might have had a percentage of that deal, and if that fell through, then her agent might have received less money, even though she did the work to gain that sponsorship. So all I'm trying to do is say that it's not as simple as one person, Simone, making one decision and it only affecting her and it only being her decision. So here is my problem with all the commentators, both the critics and the supporters, and it basically boils down to this. There's a spectrum, and let's take two extreme ends of the spectrum. If in another set of situations, not Simone Biles, but say another athlete had a very, very obvious overt mental health crisis, so say, to pick a random example, say like a member of their family had just died, somebody very close, and they were clearly upset and traumatized, then I think most people, even the right-wing, very harsh, horrible people like Ellen Wright, would agree that that's reasonable. She shouldn't have to compete under those circumstances. Now let's take the other end of the spectrum. Say that there's very little obvious indication that she's unwell and she just crumbled under the pressure and she's just feeling a little bit low or a little bit anxious and doesn't want to compete. I'm not saying that's the case, but I'm just saying take a hypothetical case, and I think most people would say that that's a bit unreasonable, that she's obliged as an athlete to overcome a bit of nerves. That's the other end. But the problem is Simone Biles will lie somewhere in that spectrum. That's kind of how spectrum works. So ultimately, the question is, where does she lie on that spectrum? Because one version is that she cannot compete, and one version is that she does not want to compete. So pay attention, because that distinction is really important, kids. The problem is, the average person, you, me, people in the media, Justin Bieber, right-wing commentators, don't know for a fact whereabouts on that spectrum she lies. She knows, maybe the people around her know, but nobody else knows for a fact, and that is ultimately the question. Where on that spectrum does she lie? But I think the difference is that I'm at least recognizing that I don't know. My boy Socrates once said, the only true wisdom is knowing that you know nothing. And I know that not because I read up on Socrates' philosophies, but because I watched Bill and Ted. And if you want to read up on his philosophies, it's under 𝐏𝐬𝐲𝐡. So far in this video, all I've done is really outline the factors, the perspectives, the kind of relevant viewpoints. I haven't yet told you what I actually think, and I'm about to, but before I do that, I just want to very briefly introduce you to this channel, A Psych for Sore Minds. So I release videos every Tuesday and every Friday. The ones like this tend to be very quick snapshots and thoughts and opinions. The Tuesdays are deep dives into a whole range of issues, from high profile cases, some of them related to true crime and offending, because I'm a consultant forensic psychiatrist, so that's my area of expertise. I work in courts, I work in prisons, I work in secure units reserved for the most dangerous defendants. Talk about individual diagnoses, interview ex-patients. What I'm trying to say is there's something for everybody on this channel. Subscribe and go check it out. Okay, so what do I think about Simone Biles coming out with mental health problems and deciding not to compete at the Olympics? I've kind of been pussyfooting around this topic for this video, just like a spotty kid who's too scared to ask a pretty girl to the prom. This is what I think. As I said before, it depends on where Simone Biles is on that spectrum of cannot compete due to mental health issues versus doesn't want to or doesn't feel comfortable to compete. Now, as a psychiatrist, sometimes when I do clinical negligence cases, I have to assess how psychiatrically unwell a person is in relation to something that's gone wrong with them. And there's definitely been cases that I've personally seen where somebody has exaggerated their symptoms, known as malingering. I've got a whole series on faking mental illness, go check it out. And they do this for financial gain, for compensation. Doesn't happen that often, it's a small minority, but I've certainly seen people who have presented to their GP with anxiety and depression and have got a sick note and have used that in their civil claim and have got a lot of money. Then later on they've been investigated and their level of physical functioning, for example, doesn't match what they've reported to myself, what they've reported to their GP. However, despite all of that, despite the fact that deceit happens, I absolutely fully believe Simone Biles, and I'll tell you why. She is an Olympic athlete. She's very successful. She's not somebody that's trying to make excuses for a poor performance in life or in general. She's somebody who has competed at the highest level. So why wouldn't we believe her? Why wouldn't we give her the benefit of the doubt? If she says that she cannot compete as opposed to she doesn't want to, then yeah, I believe her, just in the same way as I believe Scottie Pippen had a headache. There's no other explanation. Why would he, who is a elite level player who usually plays really well, why would he suddenly underperform? It doesn't make sense. So absolutely I support her. However, I don't just support Simone Biles blindly just because she said she had a mental health problem. I had to look into the relevant factors and have a think about them, and also know my limitations. And I think it's a bit naive and it's a bit arrogant to either immediately judge her and criticize her, or immediately support her and just say straight off the bat that any kind of issue that she brings up should fully be supported and not thought about, not investigated. Because, in my view, that is making assumptions of where she is on that spectrum. Just want to give you one final thought, which is about the Twisties. So I mentioned that at the beginning of the video. So the Twisties is a very specific disorder to gymnasts, and it is associated with being disorientated in midair and not knowing exactly where you're going to have to land. I think this can't be overstated, because if this is correct, then absolutely that's going to affect her performance. And it's not something that I've personally heard of. I mean, you know, you get tennis elbow, you get golfer's knee, you get shot put's ball sack, and all of these kind of sports related injuries. I've not heard of it, but that doesn't mean it doesn't exist. It's just that, you know, it's a very specialist kind of area, and gymnastics as a sport is not actually that common. So if what she's claiming is accurate, and again, I've got no reason to not believe her, I'll give her the benefit of the doubt, then I think that's probably very significant, possibly even more than any mental health issues. Although I do think it's important to distinguish that that is not a mental health issue. That is more to do with coordination and proprioception. And if you don't know what proprioception is, then maybe you need to work on your vocabulary game before you can hang with me. That would be a neurological condition. So I suppose it's got some similarities in that, like mental health conditions, it's not something you can see or that can be tested easily, which means that some critics might question its validity. But as I said, I believe her. I think that is extremely significant. Okay, so that's the end of my video. It's been a pleasure to talk to you guys. Check out the rest of my videos. I'll see you soon. Stay euthymic, and please do not forget, I love you.